Hey guys, what's up? Welcome back to my channel. Today's video is going to be all about differences between a labor and delivery nurse, postpartum nurse, antepartum nurse, neonatal nurse, Nicu nurse. I feel like there's a lot of confusion in these areas, and I do get a lot of questions on my Instagram. If you guys aren't following me, go ahead and follow me. I'll put a link down there somewhere, probably in the description box, most likely. Make sure you follow me and ask me questions because I love interacting with you guys. But one of the number one questions you guys have been asking me is what is the difference between a labor and delivery nurse, postpartum nurse, antepartum nurse, etc., etc. Pretty much the differences between all the nurses in the women's health field. So in today's video, I'm going to be going over all the different types of nurses related to the women's healthcare field and kind of go over what we do on a day-to-day basis. Pretty much I have floated to all those units, so I can kind of tell you guys what these nurses do every single day, so you guys, whenever you guys start applying for jobs, you guys can kind of see what kind of nurse you want to be. So without further ado, let's get right into the video. And I'm going to be picking the giveaway winner at the end of this video, so make sure you stay tuned for that. So the first type of nurse that I'm going to go over is an OB-GYN nurse. And an OB-GYN nurse is pretty much my main unit where I am right now and where I currently work. This type of nurse is also called an antepartum nurse, perinatal nurse. This unit is mostly for bigger hospitals. Most smaller hospitals have an antepartum unit attached to their labor and delivery unit. So if you're applying for an antepartum, perinatal, OB-GYN nurse position, they're all pretty much the same thing. And this is pretty much what I do on a day-to-day basis. I take care of antepartum patients, which are patients that are pregnant and have problems with their pregnancy, such as high blood pressure, uncontrolled diabetes, if their water breaks early, like at 30 weeks. Full term is 37 weeks, starting from 37, if you guys didn't know. So anyone that ruptures before 37 weeks, we call it rupture or breaking their water. Anyone that ruptures before that time will come hang out on our unit, make sure they don't get an infection. We give them antibiotics. Sometimes major complications can happen if they don't stay on our unit until they basically deliver. So really emergent situations can happen if these women don't stay in the hospital whenever their water breaks, such as a cord prolapse. And that is pretty much when the cord falls out before the baby comes out, pretty much at any time. Like they can just be sitting in their bed and then they'll feel something down there and then we'll just be yelling cord. And that is just a huge emergency because the baby's head can sit on top of that cord and pretty much cut off circulation completely. So if that happens, we wheel them to the OR and they have to do a C-section. That's an example of an antepartum patient that we take care of. Other patients that we take care of on our OB-GYN unit are high-risk postpartum, so patients that have high blood pressures that need to be on magnesium, pretty much any complication that's not a normal postpartum delivery, like just a normal vaginal or C-section delivery, we will take them on our unit. Like if they bled too much or hemorrhaged too much during their delivery, they will come to us just for closer monitoring and care. And we do take care of the mom and baby. Also on the OB-GYN unit, we take care of the GYN side. So pretty much anything that has to do with women's health, such as hysterectomies, mastectomies. We do also take care of cancer patients with women origin cancers, such as endocrine cancers, ovarian cancers, and breast cancers. We take care of all of that on our unit. So OB-GYN is pretty much a very broad range of things that we do. So that's pretty much what an OB-GYN nurse does. Smaller hospitals that do have its own antepartum unit will probably most likely take care of just the antepartum and high-risk postpartum side that I talked about. But bigger hospitals will have the cancer patients, hysterectomies, bleeding, feminine, things like that, and older women, pretty much anything women health related. Next, I'll be talking about labor and delivery, and if you guys have been following me for a long time, I have cross-trained to labor and delivery, and I float there pretty much all the time. So labor and delivery nurses pretty much take care of the active labor or latent labor mom. So pretty much what you guys think of like on TV, if women are in labor and they're about to have a baby, that's what labor and delivery nurses do. They pretty much make sure that the mom and baby are both safe. We have them on the monitor pretty much, and you can see like the baby's heart rate, and you kind of manage care based on that. We do inductions as well. Pretty much the labor and delivery nurse's job is to make sure that the mom and baby are safe during the delivery, make sure no complications happen. Plenty of things can happen like infection risks, bleeding risks. Sometimes the baby's heart rate goes down below 110, which is what we like it to be, for a long extended period of time, and they have to go back for an emergent C-section. So pretty much if they are high risk, they'll be on the monitor at all times, but if they're low risk, we'll take them off the monitor and let them walk for a little bit, bounce on a ball, all that fun stuff. Pretty much we do tons and tons of interventions as a labor and delivery nurse, like turning, positioning. We do things like oxygen, give them fluids, all these interventions to make sure that mom has a safe delivery and make sure baby's okay. And pretty much when mom's at 10, they start to push, and labor and delivery nurses will push and push and push with the mom. Sometimes it's a few minutes of pushing, sometimes it's hours and hours of pushing, until the baby's head is crowning. So pretty much like this much head coming out is what we call crowning, and then that's when we call the OB-GYN doctors, and they'll push a few more times and the doctors will pull out the baby and put baby skin to skin if baby's fine. We just have nursery nurses there at the delivery, and I'll talk about that in just a second. That they pretty much make sure baby's crying, they check their APGARs and everything and make sure baby's okay. And the labor and delivery nurse will recover the mom, especially if they've had an epidural, because usually they can't really feel their legs. So we'll recover them for 2 to 3 hours usually, make sure their bleeding's controlled, make sure their fundus is firm, which is pretty much the top of their uterus, make sure it's nice and firm so they're not bleeding too much. And we send them to postpartum. If they've had a normal delivery, we'll bring them to postpartum. But if they had some kind of complication, we will send them to the OB-GYN unit. So next, I'm gonna talk about nursery nurses, and this is what a lot of people are interested in because they love to work with babies, but not high-risk babies necessarily. So nursery nurses are pretty much there at every delivery. They're there right whenever we call the doctors. They're on standby with a towel, and they stand by the warmer, and they make sure baby starts to cry, make sure their skin color is good, they make sure their tone is good, that the baby's not too floppy. So pretty much babies come out like this, kind of flexed, and they start to cry is really what they want to see. So they make sure that happens, and whenever the baby does come out, the baby lays on mom skin to skin, and they don't cut the cord right away, so baby gets all that good blood. So pretty much they make sure baby looks good, and if baby looks good, they'll do delayed cord clamping is what we call, to make sure baby gets all that good red blood cells from the placenta, and they cut the cord after a minute or two. If baby does not look good, like if baby's not crying, baby's not flexed, baby's just kind of laying there blue, not really pink, the nursery nurses will take the baby and bring the baby to the panda warmer, which is just pretty much a warmer that looks like a little mini bed, and they will do interventions like they'll stimulate with a towel. They'll use like a bulb syringe to get secretions out of the baby's mouth. They may give a little bit of oxygen to the baby. There's lots of interventions that the nursery nurse will do to make sure baby's okay, and they do vitals and all that fun stuff. And pretty much they give the baby back to the mom and help them with breastfeeding. Pretty much they just make sure baby's okay within the first few hours of life until the baby goes to postpartum. And that brings me to my next nurse, which is postpartum. Pretty much all antepartum nurses are trained in postpartum as well, because we have to take postpartum patients. So when we go over to the regular postpartum floor, it's kind of fun because they're not as high risk as our patients usually. So pretty much the mom and the baby together go to postpartum depending on the hospital. I know a lot of hospitals have done away with babies being in the nursery like you see on TV. Babies are just in a nursery and you can just kind of peer in and see in the window all the different little babies. Pretty much that's very old school, and we kind of keep the moms and babies together now, where the mom does all the care besides the postpartum nurse taking vitals and all that stuff, assessing baby. Pretty much we do couplet care now is what we call it. I think all hospitals pretty much do this. There may be a few that still have nurseries, but we do couplet care, which is where the mom and baby stays together all times unless the baby needs to go out of the room for heart screens, hearing screens, all that stuff. So right when the labor and delivery nurse and nursery nurse bring the mom and baby over to postpartum, they're together the whole time. And what the postpartum nurse does is pretty much postpartum care. They make sure mom's not bleeding too much. They assess mom and baby. Pretty much they're both together in an assignment, the mom and baby. And we can get up to 3 couplets is what we call them, which is 3 moms and 3 babies. But if they're more high risk, you may get 2 moms and 2 babies depending on what the assignment was. But if they have like a C-section, postpartum nurses will check their incision to make sure mom's pain is under control. They do weights on the baby, screens on the baby, heart screens on the baby. Sometimes they'll do labs on the baby where we just poke the baby's foot and they'll draw some labs. Pretty much everything to make sure mom and baby are both okay during the postpartum period. Usually for vaginal deliveries is 24 hours, and if it's a C-section, they stay for 48 hours. So the postpartum nurse will be providing that care until they get discharged. People that ask me what's the best job to apply for when you really love babies and you really want to work with babies, I always suggest postpartum nursing, because you can basically take care of the baby the entire night, whereas nursery nurses pretty much just make sure baby's not too critical, and they kind of just assess baby in the first few hours of life, whereas postpartum nurses get to hold babies, feed babies. Like if mom's too tired, they always give the babies to us to hold and take care of during the nighttime and daytime. So I always say postpartum nursing is the best if you really love babies and want to take care of them, and you like taking care of adults as well. And that brings me to my last nurse, which is a Nicu nurse, or neonatal intensive care unit nurse. So if the nursery nurse that catches the baby at the beginning of birth sees that the baby is not doing good, or baby needs oxygen, baby's not breathing very well, the baby will pretty much go to the NICU, and that's the ICU for babies. Of course, NICU will determine if baby needs to be intubated, or if baby needs an IV to have some extra fluids, some extra oxygen help. They pretty much are the critical care of babies, so they know how to do everything. If the baby is less than 37 weeks, if we are laboring a mom that happens to be in labor at like 35 weeks, 34 weeks, less than full term, the NICU staff will always be there on top of nursery. So NICU and nursery will work together. Pretty much NICU takes over whenever the babies are super tiny. Like if we have a 24-weeker or a baby that's just super, super tiny like this, we will definitely call the NICU to come and attend the birth, and obviously that baby will need some breathing help, so I pretty much immediately take that baby away. NICU is pretty much the critical care of babies. If you love babies and don't really like adults as much, and you don't mind doing critical care work, NICU will probably be for you. I hope this video helped you guys determine the differences between all the different women's health nurses. I love working in OB-GYN because I get the whole mix of everything. People have asked me multiple times, why don't I just go labor and delivery full time? But I mean, I just love having a variety. Every time I come to work, it's a different set. I could get cancer patients one night, I can get postpartum or antepartum patients. It's just a nice mix. And I go to labor and delivery quite often, so I get my fix of delivering babies over there. If you guys have any questions at all, make sure you leave me a comment, so I'll answer it here, or you guys can just send me a private message on Instagram and I'll answer you guys there as well. Let's get right into the giveaway winner. First off, I want to say thank you to every single one of you guys that entered the giveaway. I loved reading your responses, and I loved seeing what you guys love about healthcare and love about nursing, or if you guys are going into like medical assistant programs, things like that. I love reading every single one of you guys' responses. They were amazing. Thank you to everyone who entered the giveaway. I really wish I can give a stethoscope to each and every one of you. I will definitely be having more giveaways in the future. So I just want to say that this winner was randomly selected, so the more entries you guys had, of course, the more likely you guys were to win. So the random pick was Hiii Martinez. You have won the giveaway. I'm so excited for you. Thank you so much for entering, and I will be messaging you shortly after this to let you know that you won. So thank you guys so much for subscribing to me and being awesome supporters. I love each and every one of you. If you guys haven't already, hit that red subscribe button to join the family. And make sure you guys leave me a comment if you have any questions. Don't forget to like this video, and I'll see you guys in the next video. Bye!